Well, so, as a pediatrician, we are tasked to screen for certain things, and
Hmm.
especially that first several months when uh, a woman is adjusting to her role as a mother, right?
Yep.
Why is it important to identify postpartum anxiety or depression in this critical time period? And maybe you can step us back and define what those are if you want to, and then go into that.
So, postpartum depression is it's depression. It's a mood disorder, and postpartum anxiety is a disorder as well. I mean, very significant anxiety that we see in that postpartum period. It's not just in the first 3 months of life, although that's often when it's picked up, but it can happen anytime. Even up to a year after your baby is born. I see some amounts of kind of post-weaning depression. Some of it is influenced by the hormonal changes. Some of it is influenced by sleep deprivation and just kind of the changes in pressure that you face when you are suddenly completely responsible for this new being that most you love, that you want to do the best for, and adjusting your entire life around this little being. I think postpartum depression, we don't really fully know the rates of postpartum depression, but what we do know is that even up to 70 or 80% of women will experience some degree of a mood episode after their babies are born. At a minimum, it might be something called the baby blues,
Mhm.
but then postpartum depression is an even more severe form of that. I don't think that I knew how prevalent the baby blues were. Um, but if you talk to people, to other moms, I think that you will find that that feeling of overwhelm and I mean true depression can be more common than we think it. The reported rate is probably, I would say, between 10 and 20%. But I think that's only taking a sliver of the picture into account.
Yeah, for sure. And I've actually seen that's absolutely the ballpark, but it can even be rates of 50 to 60% if families are from lower socioeconomic
Yes, yes.
backgrounds.